Do you use other flaps for reconstructive surgery?
Yes, we do. We sometimes use other flaps, and an example of that would be skin and fat from the upper inner thigh, and that is called a TUGflap.
And when would you use a TUGflap?
We would use that in certain situations, again where patients want to avoid using implants and where the requirement for breast reconstruction is such that the patient doesn't require a lot of volume for the reconstruction. So if we could imagine that the lower abdomen is a little bit like this, with a belly button here, and then we have to imagine the patient's thighs are here. There is a muscle in the inner thigh called the gracilis muscle, and we can take the skin and fat overlying the gracilis muscle with some of the muscle as well and its blood supply, and use this for a breast reconstruction, and this results in a scar in the upper inner thigh. And when we do a breast reconstruction with a TUGflap, it is very similar to doing a breast reconstruction with an abdominal flap or with a buttock flap, insofar as it does involve a microsurgical operation. Again, we open the mastectomy scar, we place the flap in the correct position and mold it to match the opposite side, and we connect the blood vessels from the flap to blood vessels in the chest behind one of the ribs.